So the NHS has recently made an announcement regarding 28,000 dental appointments in Swansea and Port Talbot. So can you tell me more about this announcement?
A new contract form has been introduced for the NHS dentist, and four new things have been included, where the first one is new patients. So
Mhm.
that means that all NHS dentists have to take new patients, and the number of new patients depends upon the value of the contract that that surgery has.
Mhm.
So if the surgery has three surgeries or four surgery, depending upon the contract, then depending upon the NHS contract, but we all have targets to see new patients.
Mhm.
That is number one. Number two is we have to see more historic patients. That
Mhm.
means more checkups. So that is what the health board wants us to do. That means I think it's because we have to catch up after COVID, not doing extra not needed treatments, but
Mhm.
trying just to stabilize patients, like bringing them in, see what treatment they need urgently. And then the third thing is recalls. So
Mhm.
before we used to see all the patients within 6 months or like that, but now the recalls are very strict. That
Mhm.
means patients which are green, that
Mhm.
means that that means that they don't have any perio issues, their number of cavities are stable.
Mhm.
The people who are stable should be not seen before 12 months. And then the last thing is fluoride application.
Mhm.
We are advised to apply fluoride to all patients just as a prevention and to make them aware, to give them an oral health promotion, uh, things like that. So it's
What are the impacts does it have on the dental practitioners with this new contract?
well, what I feel is it's a bit confusing because we are just working on it.
Mhm.
So what I feel at the moment is that there's a lot of work to be done
Mhm.
because we need to meet our targets. We need to meet our historic patient target. We have to meet our new patient target,
Mhm.
and we have to correctly recall the patients. And then the fluoride application. I think fluoride application is okay, but
Mhm.
meeting the historic patient and new patient targets is quite a lot because um, before we were paid according to our UDAs,
Mhm.
and maybe a patient was enough to get a quite certain number of UDAs, whereas now checkups are just considered as I think one UDA. So, you know, we have to work a lot and we are stressed a lot to meet our targets.